Hi, my name is Duffy Casey and I'm a fourth-year medical student at Eastern Virginia Medical School, and I've just recently completed my first ever mission trip with Physicians for Peace and had a wonderful experience. We did a project in Honduras, in the capital Tegucigalpa, in the only tertiary public hospital in the city called La Hospital Escuela. The attending physician who led the group, his name is Dr. Brody, and he is from California, and he is a retired plastic surgeon. A wonderful man with a huge heart and lots of experience doing international medical work across the globe. And the main purpose of the project was to work with the residents and the attending physicians in Honduras that are currently working on the residency program for plastic surgery down there.
Well, I'm Carlos Arato. I'm the second year resident of plastic surgery. I'm the chief resident. And I'm very glad to receive the people of Physicians for Peace. They've been for a week. Dr. Brody is going to be operating with us and teaching us to solve very hard problems with the patient we have for the week.
I am Mario Moreira. I'm a medical student in the 7th year, and in this moment I am in the plastic surgery pasantía. I don't know how you say.
Rotation?
Passage?
Rotation?
Rotation.
Hi, I'm Claudia Coelho. I'm a plastic surgeon at the Escuela Hospital in Tegucigalpa, Honduras. Our patients are really poor people, and we have a lot of trauma at the streets, like gunshots, like machete injuries, automobile accidents. Everybody, all the people who have accidents outside come here to the Escuela Hospital. We are really blessed because we don't have a lot of supplies here, we don't have t-shirts here, and people from outside, from US, come here, give us supply, give us knowledge, and they help us to do the surgeries.
I think throughout the week, one patient that stood out more than the others was Don Felipe.
This is Felipe, is a patient of plastic surgery. He is from La Jihua, Copan. He's on the occident of the country, near to the Mayan civilization.
He'd come from a very long distance to get into the capital, and he came back this time because Dr. Brody had operated on him previously in September. But he knew that he would need to have further operations and had planned accordingly that when we came back this time that Don Felipe would be there so we could finish the operation.
And so the first thing we did was get the cancer off and tried to get him healed. And now he's got, because it was so big, we were short of tissue, so he has these deformities, and now he's going back to surgery, and we're going to fix his nose and his lip and try to fix his eye so he'll look more handsome again for the ladies.
So throughout the week we kept meeting with Don Felipe and looked at x-ray images and all the different possibilities of how to repair this complex defect. After a couple days, Don Felipe sat and he waited patiently, and every day that we saw him in the morning he would greet us with a smile and ask when we would have the opportunity to operate on him. So when you think about it, here's a man who spent days probably in transit coming down to the hospital and then waited for days in the hospital for just the chance to be able to work with a physician who came down with Physicians for Peace to get this care. So it really shows the amount of hope and expectation that people who need help are putting in this organization and the sacrifices that they're making in order to get the care that they need.
And he's a good man, he's very strong, and he's put up with a lot.
¿Qué quiere decirle, si usted quiere decirle algo a las personas en Estados Unidos?
Bueno, yo lo que les voy a hablar aquí ante Dios, que yo les agradezco infinitamente a todas las personas de los Estados Unidos y Señor también.
Tell him it's my pleasure to do this for such a nice man.
Dice que es un placer para él estrechar su mano.
So it's really neat to see how, this one physician working with Physicians for Peace was able to come down to Honduras and provide a large amount of educational experience for the residents down there who were extremely hungry for education and really excited for the opportunity, and also how he was able to connect with specific patients and then reconnect with them each time that he came down.